I'm Karen Cole. I'm the current chair of Pathology Laboratory Medicine here at North Shore. I've been here 33 years, and I have to say this is a really, really special place. North Shore has always been unique in that while it's a community-based hospital, the care that's delivered here is very much specialty care. So we have, subspecialists in medicine, oncology, surgical oncology, virtually every area of medicine, and our department is composed of board-certified specialists in anatomic and clinical pathology. These faculty are really passionate about teaching, and they're here on the floor based at Evanston Hospital, which is where the core of our program is.
What makes us different is that we have a kind of hybrid generalized subspecialty sign-out in that you get to work with subspecialists, people who have done fellowships in specific areas, but at the same time you get to see an array of specimens on each surgical pathology rotation, from your common things to really kind of complex resections for malignancies. One thing I like about being a breast pathologist is that it is very multidisciplinary. You see that in a lot of areas in pathology, but our residents, through presenting at tumor board and as well as getting involved in multidisciplinary research projects, can really kind of see how pathologists fit into that multidisciplinary team.
I'm a pediatric pathologist. I practice perinatal pathology here for the most part, and we're in the autopsy suite here. We spend a good amount of time one-on-one, the attendings to the residents, doing autopsies, helping the residents get through the case, the dissection, and the writing of the report.
We are a standalone dermatopathology section, which is really nice for residents because that's unique, because sometimes dermatopathology is within the dermatology department, but here we have it under pathology.
I function as the Associate Director of the Molecular Pathology Lab, where we do a significant amount of molecular testing, a lot of high complexity testing in our laboratory, including next generation sequencing, which is not offered at every institution. We have a very small panel for scant specimens. We can do just about 200 cells, so really helpful for very small biopsies. We also have a large NGS panel that's for solid tumor malignancy to help identify biomarkers to put patients on targeted therapy. And we have a panel for hematologic malignancy, both myeloid and lymphoid malignancies, that can help with the diagnosis or treatment for those patients.
Here at our clinical microbiology lab, we perform bacterial culture, mycology, parasitology, AFB, and molecular testing. The best things about our lab are that we have a lot of cutting-edge technology. This is our laboratory automation. We also have excellent technologists who will definitely be a part of the resident training program.
The core lab in Evanston Hospital runs about 5 to 6 million samples a year, and we are also the core lab for some of our other hospitals who will send us specimens for testing.
Very early, Endeavor North Shore has had a history of excellence in informatics. In pathology, we've extended that by building out informatics capabilities, not only in laboratory automation, but also in digital pathology and artificial intelligence. We have, great informatics programs that are bringing public health initiatives to patients.
We are uniquely leading efforts not only to bring this digital imaging to pathology, but to the patients and to the healthcare system as a whole, as a part of an enterprise imaging process. We do meet with patients. We're going to be giving patients access to their images and leading that effort. And so it's an exciting opportunity for us to share that with the world.
We currently have a residency with anywhere between 12 and 13 residents at any given point in time. And I think that residency is a great size. It's not too big whereby people get lost in the shuffle, but it's large enough whereby that residency really becomes the focal point of the department. We have a lot of support for them, and that ranges from things like having a dedicated mentorship program to providing money for books and other educational resources, and also supporting their travel and research.
So research is really important here in the department, and we use departmental funds to support a number of projects within the department, largely involving residents and allowing them to get to national meetings and to present their work. We also have faculty who are funded by the NIH and by other external funds, and a fair number of clinical trials that take place here within the department as well.
In terms of resident research projects, nearly every resident does a research project here, and many of them will get an abstract at a meeting. The biggest meeting is the USCAP meeting. So I would say nearly every resident in our department by graduation has a research project and an abstract.
So what sets us apart is not just the science, but also the environment. We have a very inclusive cultural environment where everyone tends to grow. It's not just for the faculties, but also for the trainees. We are all empowered to grow in this positive environment.
I think education is really the backbone of how our department works. Our residents and our fellows are the heart of the department. Everyone's really focused on teaching here. It's kind of our passion and what we do. We love teaching and learning from our trainees. On a daily basis, I might work with a medical student, a resident, and a fellow. Every interaction enriches, I think, our practice.
Overall, I think it's a great residency program, and for me, a tremendous challenge and a great learning opportunity.
One of the important things in this program that really stuck out to me and was really important to me was the level of support that all the residents get. They have their open door policy. You can genuinely tell they actually do enjoy teaching us.
Residency can be challenging, can be very busy no matter where you go, and there is a lot of information to learn. So I knew when I was choosing a program that I wanted to go somewhere where I would be able to come in every day no matter what was happening and know that I was going to be working with people that I really just enjoyed being around. And I can say that that is 100% the case, whether it's the attendings, the fellow residents, especially the fellow residents, or our staff.
One of the things that truly stands out in this program to me is its balance of academic excellence combined with a collaborative work environment. We don't only have a very collegial work environment in between residents. Our attendings are truly supportive, and the working support staff, including the PAs and our program coordinator, are all very helpful and are always there to help us out.
One of the biggest strengths of this program is we have a large volume and variety of cases. So as residents, that's really important because we get to see all the bread and butter cases as well as more complex cases.
You're being taught by experts in the field with a lot of one-on-one teaching, large volume of cases with a wide range of complexities. You learn a lot when you prep and present at tumor boards. There are many opportunities for research if interested. I couldn't recommend it enough.